Good afternoon. My name is Dr. Inderpal Randhawa, and I'm the Chief Executive Officer and founder of the Translational Pulmonary and Immunology Research Center. I've had the opportunity to give you updates on the coronavirus situation for the last few weeks, and I would like to do so again today. Overall, it is good news. We are seeing the number of active cases of coronavirus globally plateau or actually decline significantly for across 4 to 5 days. In addition, we've seen, especially in New York State, the number of actual coronavirus deaths decrease for the last 3 days. And nationally, we're seeing plateauing or again declining of those virus deaths, which is also very good news. From a pediatric standpoint, again, this disease poses itself as essentially insignificant. Unfortunately, there have been 2 fatal cases reported of coronavirus in the 15 to 17-year age group. But again, more information is needed on those specific cases. In addition, we have some good news development regarding drugs. The ACE2 receptor soluble format is a new model that is being pushed out in clinical trials. Think of it as a coronavirus sponge. It is injected into patients and it could literally suck up the coronavirus particles, and it's one of many different areas of new developments that is very promising. Similarly, as previously mentioned on our timelines, the vaccine development is moving very aggressively, and I expect to see vaccines active in August or at the latest September. Again, also very good news. What we will be seeing in regards to testing is widespread access. Our organization here is already offering nasal swab as well as blood-based testing for coronavirus to our employees, and we'll extend that out further to our patients as it becomes available. And I expect to see that type of availability of testing across the United States in the next number of days. And we are also seeing other interesting developments. We're seeing several countries in Europe, particularly Austria, particularly Switzerland, particularly Italy even, who are looking to reduce their lockdown measures, essentially reopening society at some level in an organized state in the next 10 days. So even in countries where they have had significant numbers of cases, they are finding strategies to reopen society. Yet, despite all of these positives, what we are hearing here, I think, across the U.S. are some negatives. We are hearing the economic despair, 10% unemployment, something we haven't seen in well over a decade. We're also seeing isolation, people not talking to each other. We're seeing increased rates of stress at home. Child abuse is going up, domestic violence is going up, and this has resulted in a state of fear. And I've spent the last week trying to understand why this communication and messaging is disconnected, where we have a lot of positive developments in coronavirus right now across the populations of the world, and yet we have this intense amount of fear. And I'd like to explain that in the next few minutes. Fear is often a result of how information is presented and how information is processed. What we know about coronavirus is 2 large areas. We know information, and there's information that we don't know. And I believe this is what has allowed us to better understand why the medical field has responded in a certain way and why the general population still is getting some degree of confusion around what our current situation truly is. If you look at the information that we know, what we do know is represented across billions of people across the world. Whether you look at studies in Asia or in Europe or in the United States, we know that for every 100 people who actually get coronavirus, half of them, 50% of them, will have absolutely no symptoms, period. Their entire 10-day of coronavirus illness will be asymptomatic. An additional 30% of them will have mild to moderate cases where essentially they will have a need for maybe some minimal medical support, but largely they're essentially treated at home. And it is that 20% who is at risk. So this has been reproduced across the globe, across many, many research studies. What is not known, this is the information that is unknown, is the amount of immunity in the population. And that's a very important set of information that we are actively studying right now. Do we actually have a large number of individuals out there who can actually protect themselves because they've generated immunity? Is there a concept of herd immunity that is actually accurate? This is currently being studied in large formats. Why are some people who are low-risk patients falling severely ill? That's another interesting question that we have yet to understand, but we are starting to study and better understand. And what level of contact equals risk of transmission? It's a very basic question. If you're in a grocery store and there's only you and one other person in there and you're in 10,000 square feet of space, that person can have coronavirus. Is that a high risk of transmission? Or if that person is within 6 inches of you, is that a level of risk of transmission? These are questions that we actually don't understand. So it is this imbalance of information of what is known and that is not known that has led our medical system to approach this in a very unique way. And what it's essentially done is this. We have a near complete focus believing that our mass population is at risk of developing that 20%, that moderate to severe coronavirus infection, the one that's the most scary. They have taken the approach that everyone's at risk of developing that. And as a result, they have been slow to develop mass testing. And indeed, the only testing that's developed quickly is testing the people who are actively infected because of this approach. Secondly, they've quarantined the entire population instead of the high-risk population because they're afraid that everyone is at risk of getting this 20% severe form of coronavirus. Also, there are no clear guidelines on how low-risk populations can function in society, how they can actually limit the risk of infection and transmission, because that's not a priority when you're approaching it this way. And finally, there's actually no process of how to isolate, how to localize coronavirus patients, and actually treat them in a closed, ventilated setting that is safe to not only those patients, but to providers themselves. This is where the approach stands in medicine, and what that has essentially led us to is a general fear of transmission as medical providers. We as medical providers have a significant concern about obtaining this virus from our patients. And this is a real fear, and it's a fear that unfortunately has led us to make some unusual decisions in how we actually manage these patients. This unusual medical approach is best summarized by saying, we will send all patients to the emergency room. We will flood the emergency system with these patients who have potential coronavirus. That is very unusual and it has not happened in history. There's no way to use telemedicine to diagnose coronavirus. There is no outpatient approach towards managing these patients right now. So given the fear that is present, these patients come to the emergency department in large numbers, and then that overwhelms the healthcare system. Now the providers, the nurses, staff, and physicians have to use lots of personal protective equipment, and what happens next is they run out of personal protective equipment, only enhancing the fear of transmission even further. And in addition, the testing that is available, nasal swab, has a false negative rate of 30%, and that does not allow us to build confidence. So this turns into yet another sequence, which is if the patients actually get admitted to the hospital, what do we do with them? Well, again, we take a bit of an unusual approach. We isolate the patients, we put them on oxygen, but we try to limit our interactions with them because of the limited number of personal protective equipment, and we don't utilize standard approaches that we typically use for lung disease. We don't use nebulizers, we don't use various forms of high flow oxygen, we don't use CPAP or BiPAP, what are called non-invasive approaches to ventilation, which are very commonly used to treat patients with other lung diseases and lung infections because they're afraid these devices will transmit this infection further to medical providers and staff. So instead, we turn to early intubation, meaning even when patients are on 5 or 6 liters of oxygen, we'll put a tube in their lungs and put them on a ventilator. And the sad truth is the survivability of being on a ventilator with coronavirus is just about 20%. So we know this doesn't make total sense, but it is the information that is being presented to us, the imbalance of the known and the unknown, that has led our medical system to conduct itself in this way. And again, I applaud all of our medical providers for all the hard work that's being done, but we have to look at this balance of information to make the best decisions moving forward. Right now, given the current information from the medical side, it's led us to believe that essentially we have an inability to control and treat coronavirus medically. Hence, our only option is to absolutely limit transmission by quarantining people at home. And this has been the approach that the federal government has taken, whether it's federal, state, or CDC. Their whole focus is on keeping quarantine measures going, getting a maximum number of ventilators, which I just mentioned previously is based on a bit of an unusual form of medical practice that's based on information imbalance, and that our next steps are fully dependent on flattening this curve. You combine this with what the media is telling us, and their whole focus is talking about the rare, unusual cases of young people dying from coronavirus, the mass elderly fatalities, and the rare first responder deaths. You take all of that together, and that's where you have this public perception that results in people believing that there are going to be over 100,000 deaths from coronavirus in this country. They believe that the only hope is a vaccine or a drug that may be years away, and that creates an intense amount of fear. And unfortunately, this is where our current information imbalance has led us. And the first question you have to ask yourself is this fear justified? And the answer to that question lies in the progress that we've seen in the last 6 weeks. Remember, the first fatal event of coronavirus occurred on February 29th. And in 6 weeks, just look at the progress that has been made. The efforts of billions of individuals across the globe who have utilized appropriate quarantine measures at home, who have changed their hygiene habits at home, who've changed their ability to reduce transmission. You've seen a complete effect of that, and that's an ability to control this virus. The efforts put forth in developing better tests, widely deploying those tests, the efforts put forth in the drug research and development fields, all of that progress tells you that things are actually getting better. And in fact, the question that should be asked is, when will this all be done? When will this quarantine be over? When can we actually get to a point where we can get back to some modicum of work, some normalcy towards school and education of our children, and some of our basic activities, and making sure that we do it all safely? Well, that only happens when we take a twofold approach to rebuild the confidence and change the information that's coming towards our population. So the confidence moving forward requires us to understand the twofold approach. And first and foremost, it comes from applying all the safety measures that have been developed at home right now during quarantining, including successful and aggressive hand washing, wearing face masks, and social distancing, and taking those same approaches back to the workplace safely, taking it back to school safely. But even more important than that is having confidence that if someone tests positive for coronavirus, that they can have a successful outcome, that they can actually be successfully managed on the outpatient setting. So I do believe that the next phase of management of coronavirus will move to the outpatient side of things. Before we go into any details on that, it's important to understand one core problem, and that is the concept of isolation. And if you look at a typical contagious disease, what happens is you go to a hospital setting and we put the patient who has the contagious disease in a room. The room has negative air filtration, and then every provider, every medical staff that deals with that patient has to wear protective equipment. So literally the care of one patient may result in dozens and dozens of protective equipment use per given day. This works just fine when you only have one patient who's contagious, but when you have hundreds of patients who are contagious, you can understand how the overuse of protective equipment can become a problem and the fear of transmission goes up. The scenario that is a better option is when you essentially flip the situation and you isolate the provider. You can put all the patients who have coronavirus in a proper geographic physical area with appropriate ventilation, and you isolate out the actual providers in what looks very much like a hazmat suit. This reduces fear, and this has actually been done in many of the countries that have dealt with this, and they've done so successfully. When you do this properly, when you can isolate the provider properly, and now there's no longer a fear of transmission, you can now deploy early anti-inflammatory therapies that are successful. Early use of nebulizers, early use of CPAP and BiPAP, early use of appropriate oxygenation strategies so you don't have to necessarily resort to ventilator use as your first and only resort of treatment. What this will result in is better overall outcomes. So the fundamental solution to this core problem is you must build the push towards outpatient management of these patients. And it will look something like this. And this is something that we've already built into our center, and we will continue to expand out this model and share it with everyone. But it involves what I call the test times 2 approach, meaning that we have to create a system where every patient is tested times 2, meaning a nasal swab and a finger poke. And what that allows us to do is to have the highest degree of confidence that we can categorize our patients properly. As I mentioned earlier, 50% of patients are asymptomatic who are positive, 30% are minimal risk or mild cases, and it's the 20% we want to identify. So if you test every patient times 2 who's at risk, they are either going to have no disease, which means that they are not a coronavirus patient, and they can simply go back home and practice their appropriate hygiene measures that are necessary. But if you are testing positive and you are in the mild to moderate case, we can manage those patients in an outpatient setting successfully. We can deploy oxygen therapies, we can do proper imaging, and really measure those patients out over the 7 to 10 days that they're going to have this illness, and of course deploy medication when necessary. And most importantly, you can isolate out this 20%, the more severe cases that are there. And even there, in an appropriate outpatient management setting, we can actually manage them aggressively to try and stabilize them. And if they do have to go to the hospital setting, at least the hospital system is not being flooded with these types of patients on a regular basis. This is an approach that makes sense. This is an approach that you will see is the next level of care, and this approach instills confidence. So I hope the message from today's presentation is that things are moving in the right direction. I will spend next week's video primarily focused on the types of testing that will be available to the general public. How do those tests work? What do the results mean? And I'll also be talking about the technology behind face masks and what makes the best work out of those different types of devices. I wish you all a happy and healthy weekend. Thank you.